Assalamu alaikum and good afternoon, everyone. A very warm welcome to this WISE panel, which is on autism, exploring optimal policies and services for lifelong care. My name is Muhammad Waqar Azim, and I'm from Sidra Medicine. First of all, to start the panel, I'd like to introduce one by one, and I will invite my panelists to come one by one to the stage. First of all, we have Dr. Waleed Cornfler. Dr. Waleed is currently the Director of Healthcare Research and Policy at World Innovation Summit for Health. Then we have Dr. Karen Goldberg. Dr. Goldberg is Reader in Autism Studies and Director of Autism Center for Education and Research, University of Birmingham, UK. Then we have Ms. Samantha Sifa. Ms. Samantha is the Head of Community Outreach at the Supreme Committee for Delivery and Legacy. And last but not the least, Dr. Abdullah Badada. Dr. Abdullah is the Director of the Family Research Division at the Doha International Family Institute, DIFI. So before we go to the panel, there's a little bit of information we'd like to give about this particular forum. Children with autism are receiving increased attention, particularly in the MENA region, with growing awareness of their varied needs. Yet health, social services, and special education providers do not provide services that effectively support them throughout their lifespan. It's important to understand how can social systems integrate their services to maximize benefits for children, teenagers, and adults with autism and their families. So, first of all, to start the discussion, and actually these challenges are mentioned in Qatar's National Autism Plan also. First of all, especially this is very focused on Qatar, insufficient data to understand the current situation, insufficient provision of services / education, stigma in the community and the providers, services are not integrated, difficulties in early diagnosis, there's no way of monitoring the quality of interventions, lack of support and services for children, teenagers, and adults with ASD and their families. And lastly, which is extremely important, that limited availability of trained staff. Something very amazing happened in Qatar. Qatar is the only country in the region which has national autism plan, which is amazing milestone that this country achieved. And the vision of the plan is individuals on the autism spectrum have the right now and in the future to receive the right care and support and to have the same opportunity as their peers within a society that accepts them. So, when we talk about Qatar National Autism Plan, and it's interesting, quite a few of the folks who were involved in making this plan are sitting in this room. So I had the privilege of working with some amazing people who developed this plan. It took 2 years to put this plan together. And it was released by Prime Minister in April of this year, along with the 7 ministers present over there. So there are 6 major pillars of this plan. First is the awareness among the general public and the providers and around the country. Second is early recognition and screening of autism. Third is diagnosis and assessment done at the right time, at the right place. Fourth, that we have effective interventions which are evidence-based. Fifth is role of schools, education, extremely important, because children spend most of their life when they're growing up in the school system. And sixth is transition to adolescence, adulthood, and elderhood. Um, I have done this presentation on National Autism Plan, and a lot of people ask me, what is the reason that Qatar able to pull off this plan? And if I have to think back, I think there are three major reasons why this country was able to pull off this plan. The first one, I think the country's top leadership behind this plan. So there was full support from Prime Minister, 7 ministers, including Minister of Education, Minister of Health, Minister of Transport, plus support from Her Highness Sheikh Moza and the Emir. Secondly, I think it was very important that all the stakeholders met on a regular, at least monthly basis, sitting on the same table, working together. So having in this country all the stakeholders coming together, forgetting about their differences, forgetting about their egos, everybody being equal, working together made a huge difference. And the third, the most important thing, I think parents and families are the champions in this country. And they played a huge part in making this happen. So I think those are the three major reasons. It is heartening to see the progress this small country has made. I think over last 1 year, we have seen some amazing things happen over here. And I will give some brief examples. Some of you know last year we did a forum from Wish, in which there were experts from 5 continents which put a report together which talk about what should be the recommendations, especially in underdeveloping countries, how to improve the services for children and families. Secondly, WISE producing a report, and one of our panelists, of course, is sitting here, who is one of the main authors of this report, and this report will be available at the end of this session, talk about students and the impact of students in schools and how to improve their lives. Third thing, I think, which happened last year, that Qatar Foundation opened Reynard Academy, which is state-of-the-art school for children with autism. And that's not the only school. There are a number of other big schools, good schools, excellent schools, which are doing some amazing work in the country. And before I go to the panelists, one last historical thing, that Her Highness Sheikh Moza proposed to United Nations in 2007 that there should be a World Autism Day. And that was accepted. And now we celebrated World Autism Day every year around the world. So I think a lot of positive things about that. So there was just a little bit of background and start, and now we'll go to our panelists for a little while before we'll come to audience questions. First thing we're thinking, many people lack a clear understanding of what autism is and what individuals with autism can and cannot do. How can we improve awareness and societal acceptance of autism as a different way of being rather than a different one? And how can this be done in Qatar? I was thinking this will be an excellent question for Samantha to give her thoughts about that.
Sure, more than happy to kick us off today. Good afternoon to you all. As introduced, my name's Samantha. I work for the Supreme Committee for Delivery and Legacy. And one of the things we've achieved over the past 12 months in partnership with several people in the room here today was a sensory room that was opened at the opening of Khalifa International Stadium, which was in fact the first 2022 World Cup stadium to open. Now, that was a huge feat for us, mainly because, precisely as you mentioned, thinking about being barrier-free, talking about awareness, societal acceptance. For us, we were really keen to ensure that we made a statement about this World Cup being inclusive. And we don't just mean that in terms of wheelchair access and hearing loops. we mean that in terms of all types of disability, all types of accessibility. And so we worked with local partners to deliver this sensory room in the stadium. And in terms of media awareness, 48,000 people attended the opening of Khalifa Stadium, the Amir Cup final. And we had global coverage of that sensory room. It was the first in any sporting venue in the Middle East. And in fact, even when you look globally, even some of the best examples in the world, the Premier League in the UK, one of the oldest and most prestigious leagues, only have a handful of clubs that actually have sensory rooms. So it's a real feat for us to start moving in that direction. And the acknowledgement by the media was fantastic, because of course for them it was, I think, something unique here in the Middle East, a real acceptance that we want to ensure that our tournament is accessible and leaves a legacy of inclusion in the country and starts to build that awareness globally.
Thank you, Samantha. Karen, I think you'd like to say something about this?
Yes, please, yes. It's fantastic to hear what you've been doing, and I think it's really, really important to broaden out accessibility, because that's the only way that we're going to have inclusion. We shouldn't just be talking about inclusion as existing in school communities, it's more broadly in society. I also think we need to think very carefully about how we portray autism and how we talk about autism. I feel very strongly that we need to change our terminology and our language and our way of presenting autism to be looking at it as a different and part of diversity, a different way of being, rather than deviant, disordered, using language such as illness. I think that's incredibly important, because once we change that perspective and we look at autism like that, we emphasize strengths, we emphasize the contribution that autistic people make to society, and we change the way we behave towards autistic people. And we work a lot with adults with autism who tell us that when they got a diagnosis and they were told everything that was wrong with them, it wasn't a very good way of selling autism to them. And they are very proud of being autistic because they know that they have so much to contribute. So I think that's a very important part of our awareness raising and acceptance.
Thank you, Karen. Very important point. I know Waleed must be itching to say something about role of wish in the media.
Well, Bismillah ar-Rahman ar-Rahim, in the name of God, the most gracious, the most merciful. So let me take this conversation 11,000 meter high. I think it's important to provide a bird's eye view. When you talk about public outreach and you talk about enhancing awareness, you are talking about working with stakeholders. And to work with stakeholders, in order to be successful, it's a three-legged stool. So one of those legs, and an important one, of course, is a national plan, but at the same time is the presence of a national committee, an interagency committee that allows the coordination at a national level for a variety of programs. The second leg of the stool, it is the training and education, professional training and education, and third is partnership. So global partnership in particular, besides the local stakeholders. So let me give you a specific examples in terms of how we at Wish approached this concept and how we worked with a variety of stakeholders. So from the national level, we have been participant at the national strategy, the autistic strategy plan. So we have representation, and we have representation on a variety of committees and work collaboratively. And you yourself have been the chair of the forum of the WISH report that has been produced, and you represent CIDRA. So this is a concrete example in terms of how we can work with stakeholders like Ministry of Public Health, like Hamad Hospital, like CIDRA, and so forth. Let me give you another example in terms that connects actually education and global partnership. We have been proud of our partnership that we has established with the charity, the Liverpool Charity Foundation, and that has been integral. So if you think of an individual, and using the word individual autistic, it's you think of sort of the mind, right? And you think of the body, the physical, and you think of the spirit. So in that sense, not only we have provided an avenue by working with QF community development to access the facilities, not only we have provided an avenue for the children to participate in sport, more importantly, we have trained individuals locally so that they can go out and reach and enhance the awareness, whether it's the local schools or other, stakeholders. So these are just a couple of quick examples that highlight this important concept of global partnership, professional education and development, training, and third is the participation at the national level.
Thank you. Thank you, Walid. I think all are very important aspects you talk about. Next, for Dr. Abdullah, I have a question, which is, of course, I know a lot of our parents or families are sitting over here. It's very dear to their heart. So it is especially question regarding the families. Various services are offered to individuals with autism, but are they integrated in a manner that they best serves the need of the individuals and the families? So, giving an example, how about the families? Should service planning and provision follow a child and family focused approach around the lifespan, not just as a child or a teenager or adult, like around the lifespan? And what impact do families have on the individual with autism? And what impact kids with autism can have impact on the families? And how you integrate all this together? So some of your thoughts on that.
Thank you. Well, I'm gonna talk from my own, learning from families. So this is an important thing because I cannot, communicate their experience except what I heard because they know more than me about their experience. I do not have, someone in my family with autism. So regardless of what I'm gonna say, it will be short. So that will, later they will talk about it because I don't want to be unfair to their experience. That's one. Second, again, I'm gonna talk a little bit from what I heard from them, that all what I heard is frustrations from them because of lack of, integrations in all the, activities, services that they receive. It's like they don't talk to one another. They go to, let's say, CDC and, diagnose their child, then they don't know where to go. That's it. The rest is shopping on their own, connections, their abilities to communicate, and that's, create frustration and anger, among families. They are doing their best to help their child, like all of us, regardless of their, health conditions. They want to do the best, but sometimes because of the idea of awareness, they sometimes encounter healthcare providers who basically tell them, that's it, you're done. That's the only thing I can offer you and go do whatever on your own. Some, they give them even, so to speak, breaking the news in a negative way. This awareness is not only for the public, but also for the healthcare providers to learn how to communicate. This is what you have, and here is, a pathway from A to Z, rather than you are on your own. Sometimes, like, you don't want to hear even the diagnosis because it's not helping, rather than it's hindering their efforts to help their child. So that's just in brief. Maybe we'll elaborate later, but that's the most important thing is lack of integrations, services, what I heard and I met people, they are not on the same page. Unfortunately, it's more like competitions. Survival for entities to be able to, it's a healthy one, but the problem is competitions that they lost, the ultimate goal for their existence is to help families. That's, I think, what I noticed, and that's just a little bit now, and maybe later we'll elaborate. Thank you.
Very well said. I think on the same point, I know both Karen, your work do talk about some of this, and I know Wish report talks about this. So you both wants to give ideas, but not just to talk about what the issue is, but what the solution is also. Please.
We found the same issues that you've highlighted here, particularly with frustrations for families. And even when families got some support on one level, then there was no follow-up to that support. So when we talk about gold standard, we have our dreams about the best possible services that we could have for our families of children with autism, then we would want to have services at every single level. Pre-diagnosis screening, to diagnosis, post-diagnostic support, early intervention through to primary school, secondary school, and then post-secondary school into adulthood. And as you have highlighted in the National Autism Plan, elderhood, support in elderhood as well. So that would be the gold standard, and there would be a clear pathway through all of this. But the big question is, how do you achieve that? And I think there are issues to do with the systems level, but there are also issues related to individual levels and the kind of professionals you need that are supporting families. And I went to a very interesting presentation here at the summit, where there is also a report on this. Andy Hargreaves has done a report for WISE on collaborative professionalism, where he looks at what kind of elements are really important in professionals collaborating. And I think we need a sea change many places in the world towards professionals who know what it means to be collaborative professionals. It takes time, and you have to be able to listen, and you have to be able to work with people. But I think if we're not able to do that, we will fail our children and we will fail our families. So I think that that's an important solution, and that requires training. But I know we're coming back to training as well.
Thank you, my colleagues. Certainly, they have pointed out a couple of important issues. So let me summarize them and give a perspective in terms of a solution, because it's easy sometimes to talk about the problem and forget about the solution. So families are the cornerstone. And as such, families need to be represented at all levels in a national committee. And I think unless there is a national program that drives the process where families are represented on this national committee and their voice is heard, then there is a disconnect. That's number one. Number two, when we think of solutions, it has to be locally grown, homegrown solutions. It's easy to borrow, from the playbook from the West or and so forth, but it's vital that it is a homegrown solution where it's Qatari thought and Qatari based and Qatari, sort of schooled for the families and the children. So let me give you a couple of case studies that have been highlighted in our report that specifically targets sort of the education and teaching and family involvement. The first is a case study in France, and the other is a case study in India. Not that we have to borrow everything, but it illustrates how we can contribute. So in the Indian case, it was about professionally training and developing teachers in order to identify the issues and in order to help families. So I'm just summarize it very simply. In the French case, it was about engaging families and enhancing the diagnosis through clinical and regional centers. But in every single case, family participated. And in every single case, it was a national program. And in every single case, it was thinking about the families, the processes, and ultimately the patient. I mean, whether it's children all the way to elderhood.
Samantha, you want to add anything, your perspective on this?
Only having heard all of this, a few things come to mind actually. The role of the family, the integration of the family, and of course the individual as well, and the notion of working in collaboration. I mean, we established last year an accessibility forum, which is essentially to bring together all these entities, so individuals, families, organizations that represent people with disabilities here in Qatar. And the idea is that they, alongside our stakeholders, so when we talk about our stakeholders, we mean our the infrastructure partners, those that are, of course, changing the face of this country. Qatar Rail, of course, Ministry of Transport and Communication, Hamad International Airport, Ministry of Municipality and Environment. We work very closely with them as stakeholders to determine the needs and ensure that collaboratively they're being delivered. So in terms of the role of the family and the individual, I think it's integral, actually, in how the country moves forward and the direction in which it moves.
I'm pretty sure when we'll come to question and answer sessions, I know a lot of our esteemed audience will have a lot of information and input on that particular topic. I'm pretty sure about that.
Just to add something, I mean, if you look at this, you see that CAFA has been represented at the National Autistic Plan, and I think that was very sort of the catalyst that stimulated the process. So that's, you know, I mean, that's a testament actually to Qatar, to have an advocacy group that reaches that level. I mean, it's a true testament to Qatar.
The idea of not borrowing or home growing, it's a good idea, but not realistic. You know, all what we do is done outside. You know, and we cannot reinvent the wheels. We adopt certain things. And the second thing, I maybe missed it, but you talk about France and India, so I did not get the idea of, is that kind of application to use the knowledge of
it's an advocacy of a national plan with the involvement of families. So that's the whole idea. And I gave an idea about education training for the teachers so that they can identify the kids and also develop a special plan, educational plan for those kids. That's number one. And number two, the involvement of the families with clinical centers and regional centers for both screening, surveillance, and diagnosis.
So as you mentioned about education, I think that is a very relevant area, not just in Qatar, but globally. So the next topic is about education. So education and professional development of specialists who deal with individuals with autism and their families is crucial in achieving ambitious plans such as Qatar National Autism Plan. How can we best prepare and support specialists, teachers, and social workers and other professionals to enable them to provide high-quality services? So it's not direct to anybody. It's open question, whoever wants to take that on.
Let me take this on and at least present it from a healthcare perspective. I'm going to give you an interesting statistics, and that statistic actually is from the West, but it's telling in terms of how countries, developed countries, are suffering. One statistic, which has recently, there is a paper that has been published that points out, that was published by Kaiser Permanente. Kaiser Permanente is one of the largest healthcare systems in the US. And they have done a survey that surveyed their physicians. How much do they know about autism, and how much can they have learned in terms of how to deal with autistic kids? What's shocking, within the Kaiser Permanente system, 79% rated themselves either poor or fair. And that's in the West. So imagine what it is like in third world developed countries. So the issue between high-income countries and low-income countries, I mean, the gap is widening. The issue is that there is no evidence base. Rather, people offer opinions. And I think opinions are a dime a dozen. You know, I mean, the research has to be evidence-based. And as such, you can see that why Qatar is actually in a unique position. And some of the advocacy groups and centers like the CDC, like CAFA and others, in terms of working collaboratively and particularly by incorporating actually technology as well, that, you can make really a difference, not just a difference locally, but even a difference globally. I mean, this is a global problem that have a tremendous local ramifications. So that's just from a healthcare perspective, and I can talk about other things in terms of how you integrate all these things and what are the challenges and what are the solutions. I'd be glad to talk to anybody about that.
I know Karen probably wants to say something about teachers in schools, right?
Is that okay? Yeah,
Please
thank
go
you very
ahead.
much. I very much agree with all the points that have been made about the need for homegrown solutions. It's something that we've emphasised very strongly in our report. And when we talk about homegrown, we talk about the content and the resources that need to be developed, even diagnostic tools. A lot of the diagnostic tools have been developed in the West and then aren't necessarily adapted or need to be adapted for here, and it's the same in education. So there's a big job to be done there to make sure that we do that, and I totally agree with you, it needs to be evidence-based. Yeah, absolutely, and it needs to be locally based. Having said that, I just wanted to give an example of something that we've done in the UK in relation to training of teachers and continuous professional development. Not because I think that should be applied here, but there are some underlying principles related to that I think are relevant here, particularly from everything that you've all said. So in the UK, the Department for Education funded an organisation called the Autism Education Trust to develop training materials for teachers. My university and my research centre were commissioned to develop these materials. But we developed the training materials for teachers based on findings from our previous research. So we were clear about what do teachers need, what do they already get now, what are the important messages we need to get across to children in order to optimise the learning environment for children with autism. But the crucial thing about these materials and the training that we developed was we developed it in partnership with families, in partnership with autistic people. They were crucially involved in all the work that we did, in partnership with teachers, and in partnership with the providers, the people who were going to provide the training. So the Autism Education Trust set up different hubs across England, and the hubs were the people that were developing the training. We trained the trainers and we supported them, and we developed resources in partnership with them that they could use in the training. Now, to move a few years forward, 150,000 teachers in the UK have received this training, and another university has evaluated the impact of the training and have found that teachers have changed their practice. They didn't just change their practice over a short period of time, they actually had changed their practice a year later too. So to me, the lessons from that isn't that we should apply such a model here, although we have adapted that model in Greece and in Italy through an EU-funded project. It isn't that we should wholesale implement it anywhere else, but that the lessons from that is that if you develop something collaboratively, which engages a number of stakeholders in the community in the way that you're all talking about and you're doing in relation to the National Autism Plan, then you can make a much bigger difference than if the training is piecemeal and there's a little bit here, a little bit there, and people are saying very different things. You know, it's coordinated, there's some core messages, but you can still individualize it within that. So I just wanted to give that as an example because I think it helps having something concrete.
So actually, I'm thinking when you talk with the teachers or health professionals, they're very busy, right? Yeah. And they will say they don't have time for more training. So what you say, how to have a buy-in, and where you create that time to get that training, what you will say in that regard?
Well, the teachers in the UK, there's training at different levels. So the level 1 or the tier 1 training is only an hour and a half. So we get the head teachers, and well, we don't, the Autism Education Trust does, gets the head teachers and the leadership to commit themselves to putting that training on in the school and expecting all staff to attend it. Once they've done level 1 training, they usually want to do more because they learn from it and they enjoy it. And then they can go on to level 2, then on to level 3, and we then see them come on and want to do university level accreditation as a result of it, because we talk about people getting bitten by the bug of autism. They become so interested in autism because they learn so much through it that they want to continue with it. And I have seen that. That isn't just kind of making it up. It actually happens.
Professionals are very busy, but professionals also value professional opinion and professional interactions. Let me share with you a little bit of an experience that we had recently. Recently, we were in Oman and we presented on autism and dementia. We had the opportunity to meet with the president of the Autistic Society there, which is the equivalent of CAFA. And also we were at Sultan Qaboos University, where they're creating a center for research. So if you look at it from that level, it's about leveraging the knowledge, leveraging the interaction, leveraging the type of solutions that can be applicable in the GCC. So it's not just about them feeling isolated or them feeling that there are no other. I mean, we've heard stories from moms in Oman. One could cry, you know. So they have similar experience. They have similar challenges, and perhaps one proposal is to have a sort of a mini conference or a workshop or a gathering that where we can invite the moms from the region, from Kuwait, from Oman, and meet in Qatar and talk and share and propose new solutions, you know. And I give you an example, a personal example. I mean, saying this publicly. One of my children, my eldest daughter, she's a highly functional autistic. I mean, right now she's at the university doing her master's degree, right? When we went to the physician, and we suffered like for 20 years before she was diagnosed, right? You know what was his response? He prescribed a psychotic drug, you know, that promotes suicide. So they're busy, yes. But one day they'll be sick and the physician will look over them. They might not be busy or they might be busy.
So we were talking about buy-in, and actually this I will be very interested to know, Samantha, your thoughts. Sometimes celebrities can play a big role, and we're talking about sportsmen, and soccer is or football. Football, like I came from US, so football is different football, but here football is soccer. What those kind of players can do in this regard?
I can't deny the draw of a celebrity footballer. I think in our case, though, regarding the World Cup, I think it's actually more than the sports, more than the game. It's the first tournament of this kind to be held in the region, to be held in the Arab world. And so it's an opportunity to really showcase this part of the world and what is being achieved here. And I have to be honest, you know, when I was hearing about the training and the buy-in from individual schools, the way in which we felt that things have progressed is actually to get buy-in at very senior level. When we worked with the Accessibility Forum, we have been fortunate enough, perhaps through the draw of the Supreme Committee, through the draw of the 2022 World Cup and the changes that institutions here all want to make. That has been leverage enough actually to get some pretty large commitments made by entities here, infrastructure partners, and from this year, cultural sector partners who will be joining the forum. So I think as much as I am of the opinion that encouragement and requesting schools and trainers to participate in training, truly I think what has been successful for us is to get the buy-in at very senior level from these institutions and commit them to it and hold them to it. The success of the Accessibility Forum has been ongoing workshops, ongoing reporting, and a willingness even from our senior management to highlight those that haven't met their commitments. So I think it's very important for the sincerity of the program to actually get senior level buy-in and hold them to it.
Thank you.
Can I make a comment on technology? Sure. I would like to make a comment about technology and the importance of technology, both for the parents as well as the autistic individual. these are two sort of experiences. The first experience recently when we were in Oman and we were talking to the leadership there, and that one of the physicians there has developed an app in order to teach the children. Okay, so sometimes we talk about the parents and the challenges and the caregivers and so forth, but ultimately our goal is also the individual himself. So these types of technology, assistive technologies, and particularly applications. So he developed it for Android, and now he's developing it for Apple. Let me also take from a personal experience from the US. A close friend of mine, he's an engineer and he owns a computer shop, and so happens that his child is also autistic, I mean, to the extreme. And he himself also has realized the value of education, and so intervention is not just from a health perspective, but also intervention from an educational perspective. And he himself developed an app in English in order to educate his son. So this is just two examples in terms of the value of technology and how you have to link the services. So you have to link the services at all levels. I mean, if you think of it as a pipeline, if there is a disconnect, then there is a leakage, right? And in order for it to be seamless, I mean, technology is an excellent platform that can be used in order to connect it all the way from the beginning, from screening and surveillance, all the way to transitioning. I mean, that's one of the big gaps actually there. I mean, you know, in terms of best practices, okay, you know, where are the toolkits? Where are the guidelines? Where are the policies that should be in place in order to help the families and the children through this transitional phase, you know, from being a kid all the way to elderhood.
Good points, Walid. Changing the topic a little bit, and this one, Abdullah, for you. We see that services usually target children and teenagers. But once an individual with autism transition into adulthood, it is difficult to find proper services or resources, what to do with them, and that which can enable the person to lead a successful life. What we can do about this?
That's what you have in the plan when you moved from adulthood to elderhood. But the current situation in Qatar is after 21 you are done, unfortunately. But I hope that what you have in the plan, it will be, you know, actionable and will move to, you know, think beyond, you know, all the, I think, entities and the centers that we, you know, looked at and we examined and interviewed, it's, you know, geared toward children. So when you get to age 13, 14, it's almost over. Get to 18, 21, you're done. So basically go home and stay. That's basically the end of your, you know, the service we can help you with, which is unfortunately exists in other countries where after 21, it's, you know, that's much where they offer services for individual and autism. And there are a lot of experience in the West, as you know, we can learn from and kind of helping, you know, adult. It's also, as you mentioned in the strategy, is when you get in your 40s and 50s and 60s that, you know, a lot of parents are not going to be around. You know, that's an issue that, you know, when I talk to a lot of parents and we talk even to people who provide services, they are not even thinking beyond 10 and 11. That's it. You know, that's where we think at this stage, when they get diagnosed, when they are 2.5, 3, 4, then we throw them through the system. And 21, come and collect your kids. That's a sad part. But hopefully with the strategy, and as you know, you presented the last point, I think the point before the last is we start thinking in parallel too, because there are also individuals in Qatar who are already beyond 21, and we need to help them, and we need to think not to, you know, think only about children, but also those who are already, you know, at home. And it's an important thing to think, starting now.
Thank you, Abdullah. I'm wondering, Karen, do you have any thoughts, like any particular things you can do in this regard, like concrete examples in this regard, what a country can do at a national level?
Well, I think you're absolutely right. You need to emphasise that it needs to happen at a national level. And I think I couldn't agree with you more, Samantha, about the need for it to be top down. I probably didn't emphasise that enough in relation to what I was describing about the training programme, because that was the Department for Education that decided this really needed to be developed. And the support and the money and the resources and everything went with it. And we can't talk in the abstract about adult services. It really needs to come with resources, it needs to come with planning, and it needs to happen at national level. I've got a very personal example, actually, of where that can really work. I think any adult services, if we're thinking about dreaming and aspiring, it needs to be tailored around the individual. And my nephew is non-verbal. He hasn't got autism. He's got a diagnosis of Lennox-Gastaut syndrome, and a very complex form of infantile epilepsy that developed when he was very young. He's non-verbal. He's not toilet trained. He needs 24-hour care. And my brother and his wife got to the point where it was very difficult for them to look after him in the family anymore. They just physically could not manage it. They're living in Norway, and the services that were provided for him is he lives in a small house with 6 other young people who have special educational needs and medical needs as well. And he has one-to-one care because this is what he needs, but he comes home on a regular basis, so that when he is at home, the quality of care he gets at home is very high. Before, my brother and his wife said themselves they couldn't provide quality care for him because they were so exhausted all the time. They didn't get any sleep. Now that's individualized to him, and it's a country like Norway, which is a very well-off country, but which has a very strong commitment to developing the right kind of resources. For other people, we see several residential provisions growing up in the UK, or provisions where, for example, there are farms where people can live who are really interested in growing vegetables and fruit. So I think it needs, like in education, it needs a range of services, but it needs the commitment from the top, and it needs the resources.
I certainly agree with my colleagues that it needs to be from top down, top to bottom. It needs to have resources, etc., etc. But one way to look at it is also from the bottom up. I think it's a leadership issue. I mean, you know what are the gaps, and if you are either a policy maker or policy institute or some type of organization, and you recognize a gap in your area, it behooves you to commit to that and make the necessary research and do the evidence-based type research and make the policy recommendations. We do know that physicians are not, or clinicians are not well trained. We do know, for example, teachers are not certified. We do know perhaps certain educational plans for autistic individuals are not placed. We do know vocational and employment programs. We cannot just wait, until somebody on the top becomes aware of the problem and sort of drive it. And that's why I admire what CAFA has done. I mean, they've fought all through the years in order to get the attention of the top, right? And then national strategy is the result of that. So that shows leadership. That shows that somebody has taken the bull by the horn and sort of advocated. We recognize in the healthcare industry or in the healthcare sector that there is need to be more sort of education for clinicians. We do know that from a social perspective that there is a gap in terms of transition planning. Okay, we do know that from an educational perspective that there needs to be more teachers sort of trained and certified. We do know that. But if we just sit and wait for somebody to make a decision, I really feel that it's a leadership issue, and that we need to take that seriously.
So we will have like 5 minutes more because we started 5 minutes late. So don't worry about it. And our panelists will stay here for a while after we are done. So don't worry about it. Nobody's going any. We will lock the doors. Don't worry about it. Don't worry about it. But there's one final thing which is actually I was not thinking when I wrote the questions. And I'm looking at the audience. And if you see, at least about 85 to 90% women, right? Both parents are very important. And we know mothers bear the biggest brunt of it. Going to appointments, and we know studies showing high rate of depression in mothers who take care of children or adults with autism. Anything you like to comment on that? What to do about it? Any message for the families, mothers, what you want to say? No, but they are looking for solutions from you also.
I think what we hear so far is, which is in every issues or difficulties parents encounter. Women, as you said, or mothers everywhere, unfortunately, when it's come to caring for children, is by default, it's their responsibilities. Okay, it's a hostage of
But
their
shouldn't
biology.
that be that way? Why
Well,
is that?
that's what
That's not a cultural question.
that's what the social science is trying to change for the past I don't know how many years.
I think this is a very.
That's what we're gonna go
This
now,
is the
talk about.
exactly right time. Like we go into the audience about their questions and comments, and floor is open, so we can take the questions or comments from the audience.
My first name is Manal, but actually all of us forget our first name. Now we are mothers of Ayman. This is the special. Congratulations, Dr. Walid, that your son special, and he go to the Qatar University. Daughter. My son is diagnosed before 25 years with high function autistic. Now he is staying home. That is, you mean this maybe they give it you the difference. Actually, we start from first point. The numbers now come increase in the autistic. If you start from this point and set for the society, that is not individual problem. For whole some families, this is the society problem. That's one. Second, Qatar not third world. Qatar one world. Qatar high come. The problem here, not with the top, not with Amir, not with the high sons, Sheikh Hamouza, not with the ministry, not with prime ministry. Where is in any wallet, any place, that prime minister give you set with the moms maybe 2-3 hours to support them and to ask to listen for them. Actually here, this is not problem. Not the money, not these people. The problem here is the people between the providers, the families, and those people. They said for them, everything is okay. They put a plan, they give them money, they support. The problem here is that we need to make it this situation and make it solve the problems. We are not forced them. We are not like against them. We need to help them. Actually, we need to work with each other because we are all of us in the same society. If my son is working in engineer or my husband, that's when you support Ayman, you support the family with 6 people, at least, or 10 people. So you save your society. We need to explain for everyone that's your problem also, not problem for those people, not problem for these mothers or for these families. It's not individual. So we need to help them.
The biggest problem that we have here in Qatar, it's like summarized in much fussing but about nothing. We hear lots of things on the media and we come to lots of conferences and we have good plans, we have good strategy that I don't know when it's going to be implemented, but on the ground, the most important services are not there. Now mothers are becoming fighters, and they are not very welcomed everywhere. When we go to the Ministry of Education and we discuss with them the poor services that we have, they call it inclusion, but it's actually exclusion. When you find an autistic boy in an excluded room, away from the classrooms, the life of the school itself, cannot be called inclusion. And when you sit with the officials, unfortunately, they don't get it. They don't understand what is autism and how to be dealt with. And in response to what you said, sir, with all due respect, when you said that it should be home experience. Come on, in everything, your cravat, your sunglasses, you are using it from outside. Why do we need to experiment on our children when it comes to autism? Why don't we get used from other experiences? Why don't we start from where they have stopped? We are one world now. This is a world connected. And I can use the other experiences to start. I cannot wait for 5 more years. What is happening now? A child is diagnosed with autism. They are going through the same difficulties, the same problems that my son went through. He's 15 years old now, Khalid. So I feel really sorry that nothing has changed. We have lots of propaganda, lots of media, but when it comes to the training, to the actual teaching, there is nothing. And when you come to the schools, there is no curriculum for them. There is no assistant. There is no specialized teachers. There is no drive. There is no enthusiasm. There is no passion. Nobody's believing that they have right to study and to excel. Because they think if you are autistic and you have autistic child, it's enough just to feed them and to keep them safe. And they are more than that. And you've said your experience with your daughter. If, like Ayman, her son had the opportunities that you had in the US, and it is not a home story, you got used from services abroad. If she had this chance, her son would be now independent. And you know that it is a tunnel, and the earlier the intervention will take place, then you will have better results. It's not, an autistic person can rely on themselves eventually at the end. But nobody is believing that, so they want to keep them in asylum. They want to keep them like they don't have any abilities. No, they have, and they are geniuses in some ways. But because they have not been stimulated, they will stay like this. And some of them develop diseases even more than their previous condition. So what we need is actual belief in our kids. And we want people with passion and drive and have commitment. There are good plans, but who will implement them if nobody's believing, actually? It is not the job of us mothers. Everybody is saying mothers. Yeah, we are doing lots of things, but we cannot be educators, we cannot be health providers, we cannot be everything. Thank you.
Very well said. Thank you for sharing your thoughts.
Sure. Answer, and I'm so sorry that I am loud. I'm a Dr. Jackley, Professor Jackley, coming from medical field, medical doctor. And I have a son with autism, 28 years old. And I'm coming from US, when you mentioned the services. I just have to say one thing. It depends on the spectrum of autism that your son is. I've done 25 years, left the medical field to help autism field and to help my son. Could I help? He's 28, functionally 3 years old. It depends in a spectrum. Is it high function or lower function, verbal or non-verbal, and what he can do?
But I have the right to learn.
Yes. I've done all the services in US, and still he's 6'4" with nonverbal, but he can say, "I love you." That is the only word he can say. Now I'm turning to that. As a mom, I started NGO. I'm Albanian from Kosovo. I started center, first ever in my country, No law, no policy, no services, no nothing. 7 years down the road, we have 7 services. But again, when it comes to moms and government, is policies. Who makes a policy that my son can go 8 to 3, so I'm sorry to say freely, so mom can take a shower or go to a dentist? Who can say we pay education as all the other boys and girls are going? Yours are going to be picked up and going to school. And in US, mind you, until my son was approved to private schooling, I paid. Nobody asked me, can I? Other children were gone. My son was home. If I didn't have money or hire a lawyer or fight for his rights, then it's gender equality question when it says man and woman. Woman give birth, we take care of our children. Man has to work. Between me and my husband, he had to make money and I had to pay services. Because if he didn't make, I couldn't pay. But then it comes to family. You have other children that go to normal school, that want a play date, that want to go somewhere. And mind you, I was immigrant in US. My whole family was in Kosovo. Did anybody ask about depression? Medical field, it says you go and you lose and you go to the deep end. But you get strong because you look at your child, you have to help your child. Nobody's asking you where you get in that strength. Nobody's asking.
But we have our weaknesses.
Oh, we do. Oh, we do. I've been 28 years and I still live. And my son needs supervision because by 16, started seizuring, non-verbal, non-functional. He's 28, function 3 years old. Does not know the risk that the car may kill him. He's running up the street. But it's coming to the point that not only Qatar, not only the US, not only the Kosovo that I'm speaking on the name of where my work took me to help other mothers, because it became a passion. It became my personal passion.
It's okay if everybody is doing their role. But
That is the
not
question.
blame it all to the mother.
Who,
This is my
yeah, who does the policy?
Hasna.
Where is the help?
Excuse me, Hasna want to say something. Thank you for sharing your thoughts.
Thank you for sharing that, and thank you to our wonderful moms of Qatar for mirroring pretty much what all of us as parents go through. And yes, I understand that autism is a spectrum and depends how severe, but that doesn't take away that even a high-functioning child with no services would stay where he is skills-wise, and that is just unacceptable. I mean, I feel like a lot of moms were let down by this fact that their children could have been something, and they weren't because of that. But going back to our panel, in terms of like homegrown talent, I think it's very important to say that what Qatar needs to do is provide more majors in the university. Like we don't have a speech therapy major at Qatar University, for example. Where would we get the local talent? We have to keep hiring from outside and bringing from outside. And I think that's definitely a priority. I mean, that's my question. Even if somebody wanted to get into that field, we'd have to either go and study outside or hire from outside. This is what the problem with Qatar is. We depend heavily on outside staff. Our universities, and there's a lot of them, should prioritize offering special ed majors, applied behavior analysis. You know, applied behavior analysis, it plays a very important role in autism, and it's still very widely underrated here or unavailable, you know, and same thing, speech therapy. How come Saudi Arabia, for example, most of its universities offer speech therapy majors? We have none here, like, you know, and don't forget the language barrier as well. So yeah, that's when you're saying local talent, that's where it should be. Yeah.
You want
Yeah.
to comment? Like
Well-
we hear at least 4 different perspectives.
I'll start from the last questions. After I met with the mothers, I have some connection with Qatar University, and that's, you know, maybe the first time I say that, but I actually called Dr. Hassan Dirham and Ayman, she knows that. I said, here is what I heard from parents, and there is a need for certificate for a bachelor degree or master, for, basically focusing on ABA and other, behavioral interventions kind of specialist. And he said, go ahead and talk to the dean of College of Education's Dr. Al-Imadi. And then I met with Dr. Asma Al-Atiyya, and you know her, and she said she is more than willing to work with me and with the parents to identify schools, university, where they can help them to design a new program and start with the certificate, which is easier because they have special education, they have a program in psychology and social work, so they can take these students and train them. And that's true, most of the specialists, basically come from Jordan or Egypt. There is a training program, as you said, in Effet College, wherever in Jeddah, in Saudi Arabia, and in Kuwait. But there is, an interest, and as I said to Ayman, they need someone to say, okay, here is 1, 2, 3, and they will do it, and they are willing. And I met with Asma 2 weeks ago, and hopefully next week to, and I talked to 3, 4 universities in the United States who are leading or leaders in the ABA and whatever, and hopefully it will, start, soon.
It is part of the strategy, but training the specialists. But creating the programs, of course, require a commitment at a very high level. There's a couple of excellent things happening, which I don't know if folks know. People have heard Doha Institute of Graduate Studies name? Yes. So they are starting master's program in clinical psychology and social work next year. So there will be master level psychologists who will be trained in Qatar and will start the program in that. So what are the 4 or 5 different disciplines you think about? One is whether it's child psychiatry or developmental pediatrics. Second is psychology. Third is speech. Fourth is OTA and OT. And fifth is behavioral intervention or ABA. So those are the 5 usually thought about that are important to provide the services. And that OT, occupational therapy, that's what I meant by OT. So those are the 5 to think about. And there are 1 or 2 they're starting. Could the country can do more? Yes, of course the country can do more. But I will leave it like you want to say, Karen, because you have a center, and we were is that something which we need to think about?
Yes, I mean, I feel your frustration and I understand your frustration, and it is something that parents across the world have had to go through, because change in the field of autism, I think in every single country that I know of, has come from parents. And it is exhausting, and I think the priority, you're absolutely right, the absolute priority is to have the services. It's almost unethical for us to have big awareness campaigns if we don't have the services, because we're raising people's hopes and aspirations, but we're not able to deliver. So I think it is a really important point that you're making there. I don't have the answers to all of those questions, but I'm heartened that it exists in the National Autism Plan, and I'm hoping it will become operationalised, and it will become operationalised quickly. The other side of it is the point that you were making about professionals and passion and teachers not having the passion. I think it's absolutely crucial. Again, education is absolutely crucial. I think, and I've seen it happen in a number of countries, in our centre, for example, we have master's level programs for teachers, so they can come and do in-depth training specifically in autism, and they are working at the same time in schools, so they study part-time. Those teachers, we have been educating them since 1992, thousands of them. We have over 400 teachers a year, and every year our courses are full because the need is there. They need that training. When teachers have the knowledge, they have the power, they can change things, and they will go out and they implement change in the classroom. So it is incredibly important to have that in-depth level of training, as well as the broader continuous professional development that people need. And I think when you say there's 5 professions, you've forgotten the teachers there. I know you didn't mean that, because you're looking at it from a kind of intervention perspective. But actually, I think education absolutely is a place we need to focus, and working with teachers and skilling them up educating them, helping them to understand autism better, that will give them the passion. Because if they have the understanding and equally they have the resources and the skills to see that they can make a difference, because believe me, we know we can make a difference if we do the right things. And sometimes it's small changes we can implement that will make a very big difference. And I was a teacher for years, and I was a teacher specialising in working with children with autism, which is why I am in the field. I want to make a difference to children and families. So I think there is a big task there, and you have highlighted what the key priorities need to be. The question is then, what is the way forward to enable this? Now, one of the things we have identified clearly in our report is the need for further courses at higher education level at the universities, but we have also identified from our discussions with 71 people, parents, professionals, a number of different stakeholders, including a young man with autism, we have identified that there is passion in Qatar. There are knowledgeable people, there are experienced people who can be a catalyst for change, and I think that's a positive message we really need to take away. Sorry for going on so long.
Thank you. I just want to add, I mean, obviously the non-doctor here on the panel, but from my experience working with numerous entities here in Qatar, the will is certainly there to make a difference. I think what is lacking is the direction and the level of expertise as well, and which is why working in partnership is so important. I mean, we went in February to working with CDC and receiving the report from the Autism Symposium, to discussing with the Accessibility Forum, to in May launching our first sensory room. We are not experts in accessibility, we are not experts in autism, but we worked with people that are, and the result of that was the first sensory room here in the Middle East, and we hope to replicate that model moving forward. So I think for entities such as the one that I represent and numerous others, the will is there, the expertise is not. So I think the role of the forum and the role of this dialogue or continued dialogue is very important to enable us who have the will and the resources to actually try and do something to make a difference.
So I'm hearing the signs that time is finished, so I want to thank you, all our panelists and our wonderful and amazing audience. But our panelists are still here, and but we'll officially finish the panel, and we'll be happy to meet personally with the folks. Thank you so much.